other provisions by using the regulation of the 2026 JAM. That's number one. Number two, institutionalize quantitative sector performance through implementation of this JAM. That is my next. We have the responsible person, that's the studies of health, local governmental authorities, and the government agency. This should start one. We have the and implementation commence. Number two is also the responsible institutions service of health and especially before the next meeting should be conducted annually. Number three, increase domestic financing for health and improve timely release and installation of approved health projects. State governments, Ministry of Finance, State Ministry of Health, our education. That is the answer. Next. Number four. No, go back please. I think we have not finished. Budget. Strengthen advocacy for full implementation of basic under release the number. In this aspect, we expect responsible person to be the Ministry of Health and for primary health academic agency. This should be done from 2027. We monitor it by increasing from 84% to 95%. Currently, we are at 84%. We expect to increase about 11% by 20%. If not too much. Next, number four. Strengthen primary health care by improving functionality of PSCs from L1 to L2 and provision of basic capabilities.
Amen.
So percentage of functional PSCs. When we are saying PSC in this aspect, only PSC we have. Immunization coverage and protection to 0 dose. That's no need to do. Number 9, strengthen procurement and supply chain management to minimize stock of essential medicines, vaccines, and laboratory commodities. You can see the responsibility in the institution. So we are talking about the issue of data in this aspect. Using the E down and turning it down. Number 12. Strengthening integrated disease surveillance and response (IDSR) and emergency preparedness for outbreak and public health emergencies. Responsible entity in terms of health, Central Health Development Agency is a continuous process, and regardless of disease, important health response remain our way of measuring the assessing difference. Number 13. Expand enrollment in the Kebbi State Health Insurance to improve financial protection and access to health care. The responsible entity in this case is the chairman. Number 14. Strengthen community awareness and participation through board development committees, traditional institutions, religious leaders, women, and youth groups. Number 15. Ensure all development partners align technical and financial support with the state urban operation plan and swap frameworks. Swap frameworks. We have one plan, one budget, one conversation, and then we put out number 16. Establish a jar resolution tracking matrix to monitor implementation of all resolutions and present progress to the quarterly reviews. So I want to establish a tracking matrix that will monitor the implementation of these jar resolutions. Let's begin. Here are the comments. Participants here, and also those that are not here, we commit ourselves to these 5 things. 1. Strengthening collaboration among all health sector stakeholders. 2. Promote transparency and accountability and efficient utilization of health resources. 3. Supporting implementation of the Nigerian health sector renewable investment initiative and swap funds. 4. Prioritizing evidence-based planning and decision making. 5. Monitoring implementation of this resolution and reporting progress and subsequent quarterly reviews and the 2027 joint annual. I'm sure I'm committed to all this information. Appreciation. The participants expect appreciation to the citizens. Executive Governor of Kebbi State for his commitment and strengthening the health sector. Appreciation was also extended to the Honorable Commissioner for Health, the Permanent Secretary, society organizations, traditional religions, the media, and all stakeholders for their invaluable support and active participation in the successful conduct of this 2026 annual joint annual meeting. This is our communique. This communique was unanimously adopted by the at the closing session of this 2026 state joint annual review and shall serve as the guiding framework for implementation, monitoring, and reporting of agreed central priorities to the 2027 implementation period. Thank you very much for listening. So at this point, the item is agreed that we, for the last place in the office, don't know how necessary anything to happen. But if there is anything for us to have on the high table, we can give their input to change the food to some. Or do you have anything to say? Yes. Regards. It's open to everyone. Apart from the 2 days, thank you, sir. Permit us to make observation of this in the company we are given at the heart. Thank you very much, sir. Any observation?
Thank you, and good morning to us all. I felt in your first line of preamble, I felt Ministry of Health, State Primary Health Development Agency, but you did not capture Kichima and END. I don't know, I felt it should be included by observation.
Let's go to the first one.
Please, can you scroll down to the preamble? Yes, the first sentence gives the Ministry of Health in collaboration with Primary Health Agency. Then you go down to maybe without the including society message of this one. Thank you.
Good observation, not adding the first time.
Yes. My own is, I think that normally should be effective.
Yes.
Yes.
Thank you very much. My concern is on the resolution. I didn't see anything concerning either logistic or supply of commodities. Thank you.
Thank you. I'm glad that we are able to come up with this communicate. Mine is just a question and also a concern. Part of the resolution I see that we propose that we should be having joint review meeting. So I want to go to the difference for the every quarterly review. If we are going to have different reviews, I think that would be kind of tedious work for you to be something else. Because really for the state to have that enough time on having this able to protect our possibly looking at the finances and whatever is something that is not going to look at it is. So I'm proposing if we can match them what we are having is that okay. And also the next one is when we look at the responsible person, I can see a level of NDS, that is Ministry of Health Environment. I think we need to have like a specific person for that reason, either the director of that activity, so that we know it is the Ministry of Private Health that will conduct that activity. They will release someone that will go to account that will account for that activity, or that will put
Good morning, everyone. My name is just observation on the choice of word for the recurring activities. For recurring activities, we kept using continuous instead of continuous. So I think there are two different words.
So thank you very much. Thank you very much. The last one you mentioned about logistics. Logistics. According to logistics, please, schools, just resolutions, please. Resolutions. Small solutions. Okay, they can happen. Small solutions. Up. So, number nine, this is number nine. Yes, strengthening procurement and supply chain management to minimize stock out of essential medicines, vaccines, and laboratory components. Capture? Thank you. So you talk about quarterly reviews. I have answered that one, the AOP and this GR review, because all what you have observed here is going into AOP strengths. So this is AOP. When you talk about the responsible business, these are not activities. They are more or less strategic interventions. So when you look at activity, one of it now, we can have more than 10, 15 activities on that one. So it is when you are developing those activities, responsible person as a person. Here we say responsible institution on the top. Go to the top. Let's see the heading of this resolution. Yes, we say responsible institutions because it's more or less strategic intervention, not activity that will have a cost element and helping somebody that's responsible to push to the implementation. So under one intervention, we have more than 2, 3, 4, 5 responsibilities. If you take issue of only commodities that we mentioned, you may have more than 10 activities for that because committee was captured, supply chain and what I do, everything there was captured in only one unit. And what's the next thing? We have to I think I've answered all of the questions. Continue. Okay, yeah, that one just resolving, just correcting for the system. Okay. So from the high table now. Sir, is there any observation? So that's we can update the person. Okay.
Very good. Look at the solution.
Let's look at it. It's not captured in the Bible. Okay, this is not the final part. We are going to update all the information in this one, especially the
Let us look at it. What do you look at it?
Move on, please. Let's see.
No.
let's go.
Itu recto.
The plan that you mentioned is not part.
Okay, infrastructure. What's up?
Number 3.
Number 4, strengthen primary health care by improving functionality indexes from M1 to M2 and the provision of basic needs. Okay, let's go back to observations before the solutions. Is it here, sir? Let's go for we say significant progress was recorded in implementing 2002 primary health care service delivery improved through direct facility funding. Let's go to number 3. What is a maternal newborn child adolescent and elderly round-up was health intervention expanded, particularly through money implementation, research recommendation, performance improved. Then the national disease surveillance and emergency preparedness improved. Health data information systems, reporting data quality, and evidence-based decision making have also improved. We also made mention, okay, where we say persistent challenges include inadequate funding, shortage of skilled health workers, infrastructure gaps, commodity stock out, weak referral systems, and inequitable access to healthcare in some communities.
These are the challenges. By these challenges, what to put into the solution? What are we going to do? Who is taking part of into the solution? Issue of one, inadequate funding, then shortage of skilled health, then infrastructure gap, commodities stock out, big all these things.
They are all this. Yes, they are there. They are there separated in so many items. They cannot be captured in one place. Because those are our observations. Yes. Yes. They are all in
Out of this is still a solution.
Yes.
None of the solution discuss, talk about shortage of skilled health.
Okay.
None of the solution talks about that. None of the solution
Infrastructure gap, community stock out, good referral system,
Commodities to stock out, good referral system, inadequate access to healthcare, were all discussed.
they are all there.
But issue of shortage of skilled workers.
Still no guy is there. Okay, let's go to resolution. Let's go to resolution and see. Let's go to resolution, please. Let's start resolution from the beginning because that is where the main work is. It's the agreement. Number 1, let's do this one by one. Number 1. We said fully implement the 2027 annual operational plan using the recommendation of the 2026 plan. Number 2, we say institutionalize quarterly health sector performance reviews to monitor implementation of their resolutions. We say increase domestic financing for health. It means budgets should be increased. This is where the budget comes. Increase domestic financing for health and improve timely release and utilization of approved health budgets. So if the one you're making is that activities under this, all the activities we need under budget, timely release, memos approved, you can come under this. So number 4, strengthening advocacy for full implementation of KC under one roof. Let's go to number 5. Strengthening primary health care by improving functionality of PHCs. This one is also infrastructure. From L1 to L2, because there is criteria from L1 to L2. So when those things were met, it's improved in infrastructure. Including service delivery. Improving service delivery. Fine. So number 5, accelerates implementation of my Ramka emission. Number 6, let's maintain and improve emergency obstetric newborn care, that is CMO. Maintain and improve. So we have already started somewhere, but we want to improve. So the one we are starting, we want to maintain it also. Number 7, we say improve the referral system. Number 8, strengthen routine immunization. Number 9, strengthen procurement and supply chain, which is mentioned in that our observation. Okay, fine. Number 10, recruit equitably deploy and retain skilled health workers. It's also captured as we say skilled health workers camp, human resource camp, in that our bullet of observations. We say improve quality, timeless, and completeness of HLIS reporting and institutionalize routine data quality assessment. Number 12, strengthening integrated disease surveillance. Number 13, let's move. Expand enrollment in visitor insurance care. Number 14, strengthening community awareness and participation in what the development control. Traditional institutional religious leaders, women and youth groups. So let's go to number 16. Number 15. Okay, establish, ensure all development partners align technically and financial support in the state annual operational plan and structure framework. Establish a job solution. So I think were they all being captured in our resolutions? Sir.
What I'm trying to do out this is we know things take down so much as far as the infrastructure gaps concerning race facilities. So primarily, secondary, partly, simple tertiary. So I want to know despite huge investment by the state on health, there is still need for more to be done. So at least nobody that has done so much to this sector, when you hear of this, you have to put in a detail to work. Because you and I must believe that now that the government will be case, there's now a way to get very significant. We
I think so. When we said persistent challenges in that funding,
Who has that
so
session?
infrastructure. So we have to
That's it.
make it stated.
You left streaming there.
Yes, it's significant.
I think the language, just the way the Honorable Commissioner said, you can just put it, despite the huge investment in health sector, by the present administration, with the present government, there is still need for more funding. The language is more funding, more shortages of skilled workers. You understand? Instead of you just to go out and say, such challenges include shortage of skilled health workers, infrastructure, and quantity stock out. It shows that you have not appreciated what the government has done. If you appreciated what the government has done, the language should change. So you should change the language because you are going to, this is going to be an advocacy tool for you. This is your child, AOP and the rest. You know, your work plan is an advocacy tool. And if I have to do the government, really, without seeing anywhere where all the tests are done, you are not. So please change that.
Yes.
Yes. What exactly said. You see, we work as skilled workers. And that makes us to know that the government has appointed over 2,000 people. So these are some of the points that need to be done. And like I just said, you and I know so much about this thing. So if you just look at simply to
Nura.
attend to contractor gap,
Nura.
so you are not
Ini hotu na.
saying
Hotu.
what has been done. If you say not much is done, then that is why you can talk about this.
Amen.
Despite
Ini kawat.
by the present administration, and yet need to do more. Yes, we are not there because we never do this. We cannot do 100%. And then all the things we do equally, over 2,000 health workers are being employed, but all the same, we need to do more. Because if somebody outside me and you have a that clearly, we must understand that government has done a lot. It's not that it goes to even clearly say about 200 cases have been fertilized. But the 7 out of 31, they are not actually implement so that whoever do this can know why you are appreciating this job.
When we start, is that for the violations?
is to put it into the budget of Kebbi State so that it will be implemented. So now, henceforth, what we're supposed to be doing in terms of the template, we just need to know what are so activities that were done under ministry or so ministry. What we strengthening, what we gaps, what we achievements, and we are aspiring to have more fun for the government. What was the previous budget line? Is it workable or not? If it will not be workable, what is the increase that we are requesting to achieve that particular activities? And the other person was saying we need to have a responsible person. Yes, we are not talking about responsible person of each activity conducted in that ministry. We need to hold that ministry responsible. There must have to be a somebody who control that ministry. So definitely, that particular responsibility should be placed on him.
Thank you very much, sir. Yes.
Then you will see his own achievement. If it's in red, you will see it in red. If it is in yellow, you will see yourself in yellow. If it is in green, we clap for him. Thank you very much.
Thank you.
Thank you very much. My observation is, can you go to preamble?
Nura.
Yes. In the preamble, the Kebbi State Ministry of Health, in collaboration with Kebbi State Farmers Welfare Agency, local government authorities, and the civil society organizations. Right? Can go to the resolutions, please. I have seen it from the ground. Let's go to the resolution now. Okay, look at the first activities. One of the responsibility of the any activities here on the country. Look at number one. Fully implement 2037 annual operation plan using the recommendation of the responsible agencies is on State Ministry of Health. Family Service Agency. I think the same should be also there. We cannot favor on one, we can also be talking.
Yes.
And then again, activity 14. There are some activities that this is not to be part of the responsibility. Thank you very much.
Thank you. Welcome. So, sir, at this point, all the submissions were noted, and the editing of this, the team that started today and harmonized all our findings. Sir, our people, can we have 10-15 minutes to update you before you sign the communique? Yes.
Aje nan ko.
Yes. Okay. Now, we are going to the end of this we want to sincerely as our fellowship in our appreciation. So much for having you for the last 2 days. Your chairman actually resulted in what was resulted in this community for the last 2 years. Thank you for your leadership and encouragement. Director of Planning and Statistics, thank you for the coordination and all other necessary inputs that were put in this program to make it success. Now, we are going to decide this community. Sir, with your permission, will you come forward or if you can sign it there? Where are our photographers, please? If you can sign it here because we want to take a picture and also a video. How do you want us to do it? Next time, okay, so I think let's arrange the table at the top so that they will sign. We want this banner to reflect. Yes, that's what you have. Hello.
Mutlazor kan?
Yes, you also have to join because one partner has to sign. Chairman, the development partners, the government chairman. Okay. It is 30 minutes for the Bible here present. That please. Yes. Thank you very much, sir, for your commitment. We can now go to our seats. We hear the last lot of facts. Yes, thank you very much, sir.
wallahi ƙaryata wallahi ba su iya siya su na nake hannu ya ba su guba. Let's go.